Just one moment, I will upload the presentation for Andrei. And here comes the presentation. Andrei, the floor is yours.
Good day, I hope you are feeling well. So I'm installed in the Estonian Health Board as a consultant. My services have been made available by the European Social Fund as a part of a wider project of supporting the adaptation of newly arrived migrants here in Estonia. And also to answer questions to people who have been in Estonia for a while, but maybe have some difficulties while accessing medical services, especially the primary care, which is the biggest part of Estonian medical system. So in this presentation, I will focus more on family doctors. They are known also as general practitioners or physicians. It's basically all the same. So for people who are planning to stay in Estonia for a shorter period of time, such as like for students of the universities, like 1-2 semesters, or people here in Estonia with like D-type visa, for example, they are mostly covered by a mandatory travel insurance anyway, and they maybe even do not have to contact a family doctor. They can just go to a private clinic and get their health checkups or prescriptions there if necessary. But for persons who have like a temporary or permanent residence permit in Estonia, or who are like citizens of EU, they will most likely contact a family doctor during their stay. And for this part, I will explain how to do that if you do not know already. That's why we are here for. And also these slides, they will be sent to you by email, and also the handbook on health, like the healthcare system of Estonia, it will be also sent to you if you need a like more in-depth explanation. We have compiled it with our partners at the Estonian Health Insurance Fund and other institutions. So on the next slide, you will see my easy but hopefully an explanatory sketch of what to do with a health concern if it happens. I hope not, but if it does. So if you have like an acute health condition, you should contact 112 emergency phone number, or go to an emergency room if possible. It's a no-brainer. So acute health conditions are like severe physical injuries, traumas, broken bones, excessive prolonged bleeding, animal bites, like intensified chronic conditions, trouble breathing, severe cold, fever, or poisoning. But if you have a health concern which is not like acute, it doesn't need an emergency care. These are like sore throats, hay fever, especially in summer and spring, like diarrhea, skin infections, non-acute chronic illnesses, like you need a changing of bandages or removing stitches after an operation or surgery, mild psychiatric and mood disorders, or even substance addictions. These are concerns which should be firstly addressed by a family doctor. We also have a family doctor counseling line. It's 1220. They can help with most of the issues family doctors deal with. They have no actual medical personnel there, and they have opened an English line in English from 15 to 17 p.m. every day, on weekends as well. And they can also refer you to coronavirus testing on weekends if you cannot contact your family doctor, which on weekends usually cannot. So if at the time, if a health concern happens, no matter if it's acute or mild, if you do not have a family doctor, do not worry. You can contact the 1220 line, or if you suspect you have this like a coronavirus, I will speak of it later a bit, then you can contact like any family doctor clinic nearby. And we also have a pretty good site which explains if you should turn to emergency room or go to a family doctor, it's like the family doctor or ER, the website mentioned on this slide. You should look it up just for general information on where to turn if something happens. So on the next slide, we have these, I have some COVID-19 tips for you. So we have, yes, the COVID is actual issue, and it most likely will be for some time. And we of course, I personally hope that we won't have like a state of national emergency again, which was declared in the spring of this year. But there are, of course, movement restrictions, some restrictions on like everyday life activities, regional travel and tourism. But in any case of symptoms, if you have any case of symptoms of the upper respiratory tract or other illnesses as well, you should contact your family physician or nearby clinics for assessment of your health. In this soggy winter and autumn time, every year we have these common flus like sore throats and runny noses. Don't panic. It might not be a coronavirus. It might be just like a usual general flu. But you should just monitor your health condition. If it gets worse, please contact the nearest family doctor if you don't have one, or a clinic. And if you experience like shortage of breath or breathing difficulties, call the emergency line 112. We have asked, the Estonian Health Board has asked all family physicians to refer all patients who turn to them with symptoms related to the upper respiratory tract. And if you are referred to a COVID test by a family doctor with symptoms, it is free. You don't have to pay for that. We wish to remind you, of course, that if you are feeling unwell, please do not go to the family doctor or nurse. Don't go there physically if you can. Please try to contact them by phone or email first and describe your situation. Unless absolutely necessary, do not physically visit the health centers to keep the spread of the virus contained, of course. So when crossing the state border, for example, if you plan on leaving Estonia and coming back, the tests for the coronavirus, if you plan to take on, these are voluntary, you don't have to do it. They are available for free only to Estonian citizens and holders of a valid residence permit, or a right of residence, like temporary or permanent, doesn't matter. But it is only for Estonian citizens and holders of a valid residence permit or right of residence. If you do not take the tests while coming back to Estonia from the countries specified on our foreign ministry website, which are marked as like red, then you can stay 14 days in quarantine. You don't have to take the test. If you want, you can take, but then you have to pay if you're not a citizen or a valid residence permit holder. So more explanatory information on acts, laws, restrictions, which are like adopted by the government. For that, you should check the first site mentioned on my slides, the kriis.ee. They update it in English regularly. And for like a more specific instructions on how to like self-isolate about the virus, about the spread in Estonia, you should check our Estonian Health Board, the Terviseamet website. We have more instructions for general public and for medical personnel, and it's like a more specific. So on next slide, then I will speak a little about a bit about our like family doctors, who they are. So they should be the first contact with medical system. They provide primary care, and it means they work together with family nurses. The name family doctor may be misleading for some. They are not doctors who are helping only families. They help persons of all ages, from like newborn child to elderly. And they provide like first-hand consultations with health issues, necessary examinations. They can do minor surgical procedures, and if needed, they can consult or refer patients to specialist doctors or hospital if necessary, for example. And we also have the next two levels then, which is like specialized medical care and the nursing care. And yes, the specialized medical care is usually in Estonian health system provided if a family doctor refers you to it. There are some doctors, I will mention them later, who can be like accessed without a family doctor's referral, but by default, most of the specialist doctors require a family doctor referral if you do this through Estonian health insurance coverage. Of course, private clinics have doctors you can go to without any referrals, but they are like out-of-pocket payments. About the health insurance, we have specialists who will explain it more. And the nursing care, of course, I hope you will not go there, but it's generally provided for like inpatients during a recovery after an accident or a trauma, or for patients who are living at home, but they do not require hospital care but they have like movement or movement restrictions or chronic diseases. For them, the nursing care is also provided at home. So a patient with an acute illness, if they have a family doctor, they must be seen by one or the nurse, family nurse, on the same day. And chronic or non-urgent concerns will be addressed by family doctor within 5 work days. And please note that currently that being able to speak English, Russian, or other languages by a doctor or other medical staff is, of course, in my opinion, a modern and a welcome skill to have, especially as there are foreigners working and living in Estonia. But our ministry and government yet have not made it required by law. So you should not assume that all family doctors and primary healthcare staff or other medical personnel have to communicate in English. They have to speak Estonian, but not the other languages. Usually with Russian language, it's also not a problem, but some doctors do not speak English and it is not required that they do. In private clinics, of course, they usually speak many more languages than English, like German and French and Finnish, for example. So you can also visit clinics and doctors with an interpreter, a friend, or support person. And I, at the Estonian Health Board, I have been, my job has been made available to provide you with a service to find such like English-speaking family doctors as well. But in like bigger areas of Estonia, we can forward you to those, but it's not always guaranteed. And on the next slide, then about the family doctors as well, more specifically, family doctor as a primary healthcare provider, they are skilled physicians, and they have finished like I think 6 or more years of medical studies, and they have specialists in like family medicine. And adults and children who are relocating to Estonia from other countries, they are currently not assigned automatically to a family doctor, which of course I think should be done, but maybe we will get there. I hope so. They are not automatically assigned to a family doctor. You will have to submit an application to your chosen family doctor directly. And but newborn child are automatically registered with their mother's family doctor if mother is registered to a doctor if available. And family doctors, they have patient directories, like lists. They are usually either like a maximum of 2,000 patients per doctor or 2,400 patients per doctor if the doctor has like assistant doctors working with him or her. So, and they have also like designated service areas, such as like Tallinn, like a whole city. Patients can apply to this doctor who are living in Tallinn or like Tartu or Pärnu, but also some doctors have like a city district, like Kesklinn, like the city center district, or like Mustamäe, for example. So they firstly accept patients from like this city district. Some doctors from older times are left even with some like specific streets and house numbers, but these are like more rare today. And on the next slide, we have this link to our Estonian Health Board's registry, which we will be updating to English, but it currently works with an in-browser like Chrome translating tool, very good. And you can search there, especially the third cell which we have there. It's like a service area. You can start from your like own address. For example, I don't know, Ravi Street in the city center district. And if nothing pops up, you can just type like Kesklinn in Estonian, like the city center district. And it will show a list of all the family doctors, and I suggest you to contact those with less patients in the registry, as they are usually not so overwhelmed with their current patient base and can accept new patients. But if you run into difficulties with that, of course, you can contact me, preferably by email, so then I can think and suggest your doctors to contact. Okay, so on the next slide, I have a little bit then about the specialized care. And yes, it is if you are covered like by Estonian health insurance and you have a family doctor, they decide that you need a more specialized consulting or involvement of a more specialist doctor, then they can refer you. But as I mentioned before, some doctors do not require a family doctor's referral, so you can just search for them either on Google or on our Digilugu, the Estonian health story, like a website which collects all of the health data you have in Estonia. And you can just book a time for these doctors mentioned on the slides without going to a family doctor first. And yes, if you are referred to a specialist doctor, you basically, like all of us who are living in Estonia, you have a right to stand in line. Basically, you can choose doctors in any part of Estonia. Fortunately or unfortunately, Estonia is not a big country. Maybe you can live in Tallinn, but you require a specialist doctor. Maybe you will get a time reception faster in Tartu, for example. And if you, of course, doctors do not put you on hold indefinitely. If you have developed like very serious illness, the family doctor and the specialist doctor usually work together to adjust the waiting lists, and you can get to the specialist more quickly. And okay, about specialist care, I think that would be all. There are, of course, even with Estonian health insurance coverage, some out-of-pocket payments like visiting fees, or if you stay at the hospital, then like the hospital fee for like your room. So on the next slide, we have this private medical care providers. So obviously, the advantage of the private medical care is that you will have to wait shorter. The waiting times are shorter usually at the private care. But of course, if you do not have a separate like a travel insurance, then you will most likely have to pay for all those services. And if you have a like private health insurance, like the travel insurance, you should check up with your insurer or your insurance contract to see exactly which services are covered, as usually many of the medical services are not covered. And of course, these private medical healthcare providers have websites in English, they service in English and other languages. With that might be well, they have service in other languages as well. That is the advantage. So to conclude my presentation, on the next slide, there are my contacts. They, of course, will be forwarded to you as well. And we have excellent website of the Estonian Health Insurance Fund as well. I looked at the site and it explained a lot in depth to me. And they will, of course, just tell you about their assignments and what Estonian Health Insurance Fund can do and cannot. But you should contact me specifically if you run into a problem with finding or contacting a family doctor, or if you run into some like misunderstandings with the family doctor, for example. And we also have a legal department here. We can look into if it is like a legal issue with family doctor. Not we do not intervene in family doctors like everyday work, what they decide and like what diagnostics they do, but we can look up the more legal issues and consult you with them. So I will now look at the questions which you have provided and which have been forwarded to me. So basically, I will start from the first one then. And one question is that you have tried to find a family doctor for last 6 months, but until now you were unable to get any. So in this situation, what to do? Well, are there any alternative options? Well, not really. You will, if you want a family doctor, then if you are eligible for one, you have like the permanent or temporary residence permit, regardless of if you have a health insurance coverage from Estonian Health Insurance Fund or not. You can still apply to a family doctor. I think you should just contact me directly, and I can help you to find a family doctor. So how to find a family doctor who speaks English easier? I think also contact me. I will look up where you live and try to find local doctors who can communicate with you in English. So are insured people, do they have a right to have a health checkup every year? Well, this depends. If you have a health issue, of course, you can consult your family doctor, and if they decide that it is necessary, they will send you they will do a health checkup or send you to a specialist doctor. But there are no specific law that requires you every year to have a health checkup. If you are employed, then you will have to be referred to a doctor, like a physician of occupational health, by your employer after like a defined amount of time, like every 3 years, for example. And it has to be done by the employer. Okay, so if the family doctor's service is not good, what should I do? Can I submit my complaints to certain organization? So basically, if you have like issues with family doctor, you should firstly contact them, because it is between you and the doctor the issue which has arisen, and most health service providers as well, not only family doctors. If you have run into an issue, misunderstanding, it is like the concern of the health insurance, health service provider, like a family doctor or hospital, that this issue will be resolved. So you should firstly contact them. I suggest contacting them by in a written form, and they to reply to you as well with a written form. If you do not get any like compromise with them, then please contact us, and we will see if we can do anything, or we will forward your letter to like another organization if it's related to them. Especially with family doctors, you should, if you run into issues with the family doctor, like being rude, for example, or not, they are not working, for example, like you come to the visit, there are nobody there. No, I hope this doesn't happen, but if it does, you can contact us and we will check what is going on. So to whom to register in case of pregnancy? If by the question it is meant that you require Estonian health insurance, then after determining by a doctor that you are pregnant, you will have to submit these documents to Estonian Health Insurance Fund. But if you want a family doctor to find one, then of course you can contact me, Estonian Health Board. So I am having trouble finding a family doctor, as they say my location is not included in their range. I am in Kopli, and the nearest doctor has no more space available. What do I do? Well, you can contact me, but or you can use the registry as we specified. You can check doctors who accept patients from all of the Tallinn, and there are several doctors who accept patients from all the Tallinn, and they work in city center. It is not too far away from the Kopli. I think you can apply to them. But if you cannot, or they also tell you for some that they don't have space, so the registry shows that they do, then you can contact me and I can suggest you doctors to contact. So how to find an English-speaking specialist? I'm insured with Estonian Health Insurance Fund, Haigekassa. So as I explained, there are no separate requirements that the doctors should speak English. It's not required by law. And we at the Estonian Health Board or at the Health Insurance Fund, we cannot do much about it. Of course, with family doctors, I can help, but with specialist doctors who communicate in other languages, this is a more tricky question. And yeah, all the other questions I have already covered. So one was about if you have the state health insurance, how to find a doctor, which doctors do not have to be referred to by a family doctor. And the last question which I received was, it not mandatory to wear masks in Estonia? So I have consulted with my colleagues at the Communicable Disease Department. They say that until the government has specifically enforced it, it is not mandatory. So we at the Estonian Health Board, we can suggest, and we have guidelines about the masks, where to wear, where you should wear them, where you shouldn't, where it makes sense, where it doesn't. But ultimately, the decision is by the government. So these are all of the forwarded questions to me. I think I got them. So
Andrei, thank you.
Yeah.
Thank you very much for your presentation. We've got a couple of questions here in the chat. I will read them out loud. I think the first question you answered, and the next one is by Kathy. Good afternoon. What is the procedure for expecting mothers who aren't Estonian citizens but hold a temporary or permanent residence permit?
Expectancy procedure.
Expecting mothers who aren't Estonian citizens but have a residence permit.
So I think she means what to do if you don't have health insurance Estonian to cover you during pregnancy. So yeah, you should go, if you have your pregnancy confirmed by the doctor, then you can submit these documents to Estonian Health Insurance Fund. And more info is also on the Haigekassa website.
Yes, I think that Tina has something to say. Please, Tina.
Basically, I'm going to speak about it in my presentation, but the thing that the person should do is basically have the confirmation of the pregnancy, and then the person should bring the document into our office, and then the person will get the insurance from us. So it's if you have the confirmation that you are pregnant and you are temporary resident, then you can get the insurance from Estonian Health Insurance Fund. So thank you.
Thank you, Tina. We have more questions. I'm not exactly sure to whom to address them, but for example, what to do if you are a freelancer? If you're a resident, but you are not insured because you're a freelancer and you get sick, do you need to pay for treatment?
I think this is the question to Health Insurance Fund.
Yes, people who do not have the insurance need to pay the treatment. So yes, the person needs to pay.
What to do in case if a family doctor is always busy. Most of the times, nobody picks the call.
Well, if they do it systematically, then you should contact us with the doctor's name. But really, if you can also email them if it's possible. So yeah, but if they like systematically ignore you, then please contact us. We can then deal with the situation.
Okay. There is also Shrivastava. I'm sorry if I mispronounce. She's writing that I have temporary residence permit and I work in IT company. Where and how can I check everything about my insurance, and can I get to know that what is included and excluded in it?
So it's possible to check it from eesti.ee site. It gives the overview if you have the insurance or not. And regarding the services, if you have the insurance, you can also have the family doctor, and family doctor can give an overview what kind of services you can have. Thank you.
We also have a question, why aren't we creating a database of family doctors who could speak English?
Because it's not required by law, basically. If short answer. We have like unofficial, we know doctors who have the capability of doing that, but we cannot publish it because otherwise the doctors will get mad. If the patient contacts us directly, then we can like suggest them doctors to contact, but officially we cannot do that.
There's also a question from Ryan. I take medication for a chronic condition. Each time I get my prescription filled, it is a different price. Why does the price vary? Do we have an answer?
Basically, it's our responsibility. We would like that Ryan would send like exact question to our general email that with the name of the thing that she is taking, what kind of prescription she is having, then we can give her the exact answer, because without knowing the medicine, we cannot say why the price is different. So can you please send us the email to our general email address? So it may be a complicated question in this regard. Thank you.
We have far more minutes to answer a question, and there is a weird question, and I'm not sure that I understand it correctly, but basically a weird question. Are herbalists in Estonia regulated?
In Estonia, the regulated, which I know of, are like healthcare workers. So these are like midwives, nurses, doctors, basically. If they don't fall under that category and they are not registered at the Estonian Health Board as a like healthcare worker, then I don't think that they are regulated regarding to healthcare providing. So I don't think that herbalist is a healthcare provider, and dentists as well are doctors.
Okay, thank you very much. And I think that now it's time to proceed with Tina from the National Insurance Fund. One moment, I will open the presentation.
Yes, my name is Tina. Svetlana, can you please have the presentation?
And one moment, here it goes.
Yes, as I said, I'm Tiina Toming. I'm from Estonian Health Insurance Fund. I work as chief specialist in health insurance department. And I also have my colleague here, Eda Palm, who is supporting me. Yes, so before making this presentation, I saw all of your questions, and based on your questions, I made this presentation, and I hope that this presentation will give you an overview about your questions, and you will get the overview how to become Estonian health insured person. So, next slide, please. So what is Estonian Health Insurance Fund? Basically, we are like the institution who covers the cost of health services required by the person in case of illness. Our mission is to cover the cost of 1.2 million people for their health services to help prevent and cure the diseases, finance the purchase of medical products and medical technical aids, and provide the benefits. So basically, we are the institution who is financing the healthcare system. Next slide, please. So this is our contact. We have 4 offices. One is in Tallinn, one in Jõhvi, one in Tartu, and one in Pärnu. We have the client center service. Our service is located in Tallinn in the center. It's Lastekodu 48. It's close by to the central bus station. And if you want to come to our office, it's possible to come here, but you need to book the time in advance because of the COVID-19. Now we have the system, the person needs to book the time. It's also possible to call us. We have the chat room and also the email. This email, what you can see here, is the email where you can send all the requests regarding health insurance. So yeah, can I have now the next slide, please? So this is the main topic covered with Estonian Health Insurance Fund. So basically, the main idea behind of it who are covered are the people who are permanent residents in Estonia, or who are temporary residents in Estonia, or who are the citizens, and their social tax is paid here. So they are persons who are working here based on employment contract, public servants, members of supervisory board or legal entity, persons employed on the basis of contract under the law of obligation, people who are registered in Estonian Unemployment Insurance Fund. So basically, those are the main people who are insured. And the main idea to become insured in Estonia is that you need to have the permanent or temporary residence here, and you need to pay the social tax. So this is the fulfilling aspect. So next, please. Here I do have a small example. Maybe it makes things easier if I tell you an example. You can see here Rahul. Rahul is from India. He moved here. He's now here with a temporary resident permit, and he's working for TransferWise. TransferWise is paying his social tax, and the tax is going to the Tax and Customs Board. And we get the information from Tax and Customs Board that Rahul is now working, and because of that, he can get the health insurance, and Rahul is able to see it from the site eesti.ee. So this is the story how Rahul became injured person in Estonia. Next one, please. So there is also a second group of people in Estonia who are also having insurance in Estonia, but they are not paying the social tax. They have the equal right as the person who is paying the social tax. Those people are pregnant women. As I was speaking before, if a person is pregnant and she doesn't have the insurance and she brings the certificate to us, then the person will get the insurance. The second group of people are people under the age of 19. Those are, in Estonian case, those are the people who are pupils who are still studying in a high school. So their insurance is coming from their studies. Then there is a group of people who are students. But with the students, it's important to notice that a student must be a permanent resident. But to be a permanent resident, you need to live in Estonia at least already for 5 years. So if you just moved to Estonia and became a student in university, then you will not get the insurance via this scheme. So yeah, those are the main people who are not paying the social tax, but who have the equal status as injured person. Next slide, please. So here is again Rahul, who is now starting a family. As we see here, Rahul is meeting a young, lovely woman. She falls in love, they get married. And then Mira moves to Estonia. She's starting her studies in, let's say, Tallinn University. She has her temporary residence in Estonia, but she does not have the health insurance from us. But when she gets pregnant, she will get the insurance from us when she brings the documentation, what is proving that she is pregnant. And when they get the baby will get the insurance because the baby is living here. Here she has the temporary residence permit and she's under the age of 19. So that's the summary. But I have now the next. And then there is one more option, what is more complicated. It's a voluntary insurance. It's also possible to join voluntary insurance. Basically, there are two conditions what person needs to meet. First, person needs to be residing in Estonia on the basis of temporary residence permit or the right of residence. And the person needs to have been insured for at least 12 months over the 2 years period prior to signing the contract. So basically, it means that if a person is fulfilling those two conditions, person can sign a voluntary insurance and become insured in our institution. Yeah, but yeah, it costs some money. You can see the prices on my slide. You can now have a next slide, please. I can give you the example. So here we have an example. Here we have Smith. Smith was working as self-employed person in Estonia. He was paying the social tax and she was working for 2 years. After that, he decided that he wants to have a gap year and just rest. Then he writes us and gives us an application for the voluntary insurance. Then our specialists will looked him and they saw that Smith is fulfilling all the standards to become a voluntary insured person in Estonia, and he pays the fees and then he gets the insurance in Estonian Health Insurance Fund. But yeah, Smith was working before and he had been working enough long period to have the voluntary insurance. So then there is also an option for EU citizens. Maybe some of you are from other EU some other EU state. This is the EHIC card. If a person lives in Estonia for shorter period, maybe the person is from EU state and doing here his or her Erasmus, then this could be the best option. Basically, EHIC card is a card what gives a possibility for necessary treatment. Basically, the person is treated equally as this national insured person in this country. If someone is here from other EU state and has still the insurance in his or her home country, it's a possibility. And the person needs to get this card from his or her insurance provider from home country. So EHIC card can be useful, but it doesn't cover all the costs. You still will be treated equally as Estonian people. You still need to be paying the some fees and so on, but it's an option. So here we have an example about the Päivi from Finland. Päivi is, for example, studying here and she has the EHIC card. With the EHIC card, she can visit family doctors and it's for free for her because she has the card, so it's quite useful if a person has it. So about pharmaceuticals, one of you had the questions regarding pharmaceuticals. With the pharmaceuticals, it's basically Estonian Health Insurance Fund has a list of pharmaceuticals what Estonian Health Insurance is subsidizing. So all the pharmaceuticals that are in the list are having some sort of the discount. The discount percent is decided by the reason why the person is getting it. If the disease is very bad, the person gets the bigger discount, and is also connected with the age of the person. Pharmaceuticals have the fee of 2.5 euros. It's considered as the self-payment of every pharmaceutical. So even if the discount percent is 100, the person still needs to pay 1.5 euros. So yeah, the more information about it, it's on our website. And one more slide. One of you had the question how e-prescription is working. Basically, the e-prescription is a system. Basically, a family doctor or a specialist is prescribing you a pharmaceutical, and then the pharmaceutical is prescribed online, and all the doctors can see it, and it's inside of the digital system. And in digital system, if you go to buy it, it's visible in everywhere, so it's very comfortable. So it's visible in digiluku.ee, where you can see all your health data, like starting from your corona result ending with your prescription. And from st.ee, you can also see your insurance, and you also can see your prescriptions, what doctors have met you. So you also had the questions regarding dental care. Basically, regarding the dental care, it's very limited what the Estonian Health Insurance Fund is subsidizing. Basically, the free dental care is for children under the age of 19. There are a possibility that the dental care is for free in the case if it's very serious case, and postponing it would mean like real hard like permanent damages to your health. So only those cases are for free. So people actually need to pay for dental care, but there are some subsidizing from our side. And basically we are subsidizing like 40 euros per year for insured people, and the 40 euros needs to be like 50% of the bill what the person is having. That means that if the bill is like 70 euros, the subsidizing part can be like 35 euros. Yeah, some people have the bigger percentage, or the bigger amount of the money what we are subsidizing is 85 euros, and it's for pensioners and for the women who are pregnant and mothers of the children under the age of 1 year. So they can get the subsidies of 85 euros, and they need to pay themselves 15% of the services. And here I also have some useful links, what I really recommend you to see. And I also recommend you to see this booklet. It should be available for you. And it's everything from my side. If you have any questions, I'm trying to give my best to answer them.
Tiina, thank you so much for your presentation. We do have some questions here, and the first question is about D visa. Does official worker who has visa D has the same right for the medical services as person who holds residence permit?
Does she or he has insurance is my question. Because we don't distinguish people based on their right of stay.
We only know that the worker has D visa, and so the person is asking about the rights of a worker with D visa.
Well, if she's a worker, official worker with a D visa, then basically she has, during her stay in Estonia, the same rights as any Estonian. If she is like with this special working visa in Estonia, then she will have the personal ID code, and with it she can apply to a family doctor's registry, for example, and get the other medical healthcare services which are covered by Estonian health insurance, I think.
Yes, if the person has the insurance, then everything is fine, and the person has the same rights as a resident.
Thank you so much for your answers. Another comment is from Amos. The monthly payment of voluntary insurance is too expensive. What can you say about it?
Unfortunately, I can say nothing, but the payment is based on the minimum salary. It's the level of, it's the percentage from the minimum salary. So.
And we have another similar question from Paul. I have my own business, but I'm not making enough money to pay social tax. I would like to voluntarily pay tax in order to join Haigekassa. How do I do this?
I recommend that he would send us email to info@haigekassa.ee, and then it's possible to check what are his options joining us voluntarily and how much money he is missing from just becoming from the business side, and what would be the benefit from joining us.
Yeah, thank you. We'll share this email in our thank you letter after the webinar. And I think it's all for now. So now I'm giving the word to Piret. One moment, I'm preparing the slides. Piret, you can introduce yourself.
Hello, my name is Piret. I'm a child protection worker from social department. And may I ask you, Svetlana, to switch on our slide as well?
It will take one moment.
Here today is the head of our department, Maria Paljak, who will help me out when we have questions that are outside of the child welfare. So Svetlana, please, next slide. Our city center social welfare department is divided by 3 units. We have the social benefits unit, social services unit, and child welfare unit. All over that social services and benefits can be applied for by an Estonian citizen residing in Estonia, also an alien residing in Estonia on the basis of a permanent, long-term, or a temporary residence permit. Unfortunately, at this moment, person staying in Estonia does not get all those same benefits and services, but on the basis of a visa can receive emergency social assistance. That means emergency food, clothing assistance, washing facilities, temporary accommodation if necessary, and assistance in arranging a return trip to home country if necessary. The target group social welfare department of the Tallinn city government are those children, elderly, people with special needs, and people with coping difficulties. But they have to be registered in Tallinn, then our department can help them. The target group is not only persons who have financial difficulties, but also as there are some services and benefits that do not depend on the economic situation of the person or his family. But we do recommend that if you have difficulties in financial situation or need help with daily activities, then to turn to our department. Next slide, please, Svetlana. Here are listed our contact address, that is Pärnu Maantee 9, and we are open for citizens on Monday and Thursday, and social benefit department is also open for clients on Tuesdays. Other days we do the paperwork, home visits, etc. At the same address in our social welfare department is also located population register, where you can turn all questions concerning to population. Yes, please, next slide maybe. So in general, social benefits are divided by 2. There are state aid and local government aid. State aid is subsistence benefit. That is a financial state aid to an individual or household with a lack of resources. Subsistence level is established based on minimum expenses made on consumption of food, clothing, food fare, and other goods and services of primary needs. The For the calculation of subsistence benefit is the last month's net income of a person or family, fixed housing expenses due to the current month, and the established subsistence level. In 2020, the subsistence level for a person living alone or to the first family member is 150 euros per month. For a minor family member, it's 180, and each next adult family member, the level is 120 euros per month. Additional social benefits are offered by the local government, and on my next slide, they are listed. So, Svetlana, please. Additional social benefits are divided also in the two categories. There are universal benefits that are, for example, they are listed all here: childbirth allowance, allowance for first graders, disabled child allowance, foster family benefits, support for the user of substitute care services, independence benefit, guide dog aid, pension supplement payment, funeral payment. Those you can come and apply from here, and more information about those benefits are listed. I will give later the website where you can find a longer description of all of those benefits. But the income-dependent aid is entitled to apply to persons whose family average net income for the last 3 months of the family member is less than the current minimum wage rate. That is in 2020, 584 euros. So those income-dependent benefits, you can also turn to us and try to apply them. Those benefits take into account the specific needs of each applicant. The total amount of funds provided the payment of benefit in the city budget for a calendar year. We have the maximum amount of benefits and the income, financial situation, and housing costs of the applicant. Those all count when we calculate the amount of the benefit. Those income-dependent benefits are meant, for example, when person needs special medication, clothes, then you can apply for them. Next slide, please. So our second unit in our department is social services. Social services are they are focused on adults who have problems, who need our help. There are included domestic service, general care service provided outside the home, support person service, curatorship of adults, personal assistance service, shelter, safe house services, social transport service, provision of dwelling service, and debt counseling. If you have questions about those, you can then turn to to us. And I will not at this moment again explain all of them in detail. If you have questions later, or register time to meet us here. Next slide, please. And the third unit we have is the child welfare, and here we are concentrated to work with children in need of help, children at the risk, and child-related disputes, and also we offer benefits and services for the children with severe or profound disability. The child in need of help, they are children who have experienced domestic violence, parents and children who have problems with alcohol and drugs, parents who have low parental skill. Those children of them we consider as the child of need of help. Also when those children and families have problems at school and kindergarten. Then with them we do family-based work. We offer them counseling, family therapies, rehabilitation services for children with behavioral disorders, and day center services for children as well. The child at risk. If a parent endangers the health and life of the child, then it's considered a child at risk. And the child welfare worker in that case has a duty and right pursuant to a law to arrange the child's future based on the interest of the child. If there is a need to take the child out of the family, then we often offer children's shelter service. Also for the mothers and children, we offer the shelter service. And after the child is not anymore with the family, then we arrange foster care, then custody care and substitute home services, as well as youth home service. And the child-related disputes, well, the court will include child welfare to provide an opinion in case of child-related disputes. Normally, those questions are around custody and the terms of communication with child, divorced parents. And the benefits and services for children with severe or profound disability, those again, actually you can find listed on the web pages that are on my next slide. So Svetlana, can you please put on the next slide? So more information in English you can find in Tallinn official webpage. There is all the information in English, as well as in our social ministry webpage. You can find more information about all those social benefits and services. And I thank you for listening. And if you have any question, please ask.
Piret, thank you so much for your presentation. I can hear that someone's mic is on. Please turn it off if possible, because we have some extra noise. Okay. And we also got some feedback that the chat isn't working for some reason. Can you please let me know in chat if it is working? Or just send okay or something like that. I can see there is a message from Virginia. Okay, the quality is perfect. So if you have some more questions, or maybe social sphere, maybe a little explanation that Piret is from the city center social welfare department. It's a part of Tallinn city center government, by whom this webinar is brought today with the support of the Ministry of Interior. Basically, this is an introduction of one of the departments of our organization. So if you have some questions, you can ask. Okay, we have some questions about healthcare. Kathy is asking, can a non-resident whose partner is Estonian receive motherhood benefits, and if yes, what is the procedure? I guess it's a question for Tina.
Yes, this question should be for Tina. Is Tina still here?
Yes, I'm here. 1 second, please.
Maybe while Tina is ready. Tina, are you ready?
Basically, we're paying the benefit only for those people who have worked here before. If she has worked here and paid the social tax here, he can get the benefit from here. Basically, it's not based on the nationality; it's based on the social tax, the benefit. But if she still is, basically this is the case. And she also has the possibility for the insurance when she's living here and she proves the pregnancy here with the documentation. So she can also have the insurance from Estonian Health Insurance Fund. Thank you.
Thank you. We have also a question about vaccination. A child moving to Estonia from the EU country needs to follow a different vaccination program.
I think it is a question to Estonian Health Board, but I'm not really competent to answer that. But Estonia has its own vaccination schedule. I think if they have any want to see it, or what is Estonian one compared to theirs, they should write us to our general mail of Estonian Health Board, and it will be forwarded to a person who knows about it.
Thank you so much. Please, more questions. And in case if you feel that there is some information missing, you can also give us feedback to a thank you letter. And we will also share, as I mentioned in the very beginning, links and emails and resources that you can check yourself, and also the contacts of persons you can contact in case of your problem. So please, if you have more questions, do not hesitate to let us know in chat. We have more time. Okay, it seems like we don't have more questions for today. In this case, I want to thank all the speakers, Andrei, Tina, Piret, thank you very much for doing your presentations and talking about healthcare. Thank you everyone who joined our webinar. I hope that you got answers to your questions, and we all got smarter today about the healthcare system in Estonia. The webinar is ending. Thank you again, and the welcome letter to all the participants will be on the way soon. Thank you so much. Have a nice rest of the day. Bye.
Thank you. Bye.
About the record, we have a question about the recording. Yes, we will send you the link to the recording of the webinar. We will upload it to our YouTube channel. You will definitely receive the link by email, Virginia. More questions? If not, thank you so much. Thank you so much. Bye.